As a new practice, we are obviously seeing lots of new patients. So I want to start this video by sharing with you that the average time frame for new patients coming to us and since last seen a dentist is around 6 to 7 years.
We've often been on their to-do list, but life gets in the way, and making that dental appointment when you don't realise you've got a problem tends to slip down the priority list.
Absolutely. So we're really pleased when new patients come in and they say they don't have any concerns or problems. What we're less pleased about is then finding problems in that patient's mouth. One of the reasons that we find problems is because tooth decay and gum disease are both silent.
In the early stages.
Yeah.
Or even their moderate stages.
Yeah. So the majority of patients don't know they have either. And that's then picked up in your new patient assessment, isn't it?
Yeah, I mean, so there are other problems that we find, but the two that we're going to talk about in this video is tooth decay and gum disease. So starting with tooth decay, often you're not going to get symptoms until that tooth decay is very close to the nerve in your tooth. You might have had an occasional bit of sensitivity, but your warning signs that you have a problem can often be very delayed. And the difference that means for you as a patient is that if I get to that decay before you have symptoms and at the earlier stage, your treatment is likely to be a filling, a composite filling. The smaller the treatment that I have to do on that tooth, the better that treatment will last, and the less times you have to have it repeated, and the less severe that problem will become in your lifetime, because everything needs replacing over time.
And it's cheaper.
Yeah, so the less I have to do, the less time it takes, the less expensive it is for you. If I'm seeing you and you have deep decay, the risks are that, is it fixable? Are you going to have a root canal treatment? If you have to have a root canal treatment, you usually need to have a crown. And the more severe the treatment is, the likelihood is the next time that treatment needs to be repeated, when that treatment eventually fails, because everything does fail in a lifetime, then you're more likely to then lose teeth or need implants and things like that. So I suppose the key is if I can get to it sooner, often it's a lot more predictable and less expensive. The other issue is gum disease. So you might notice little symptoms at home. So you might notice a little bit of blood when you brush your teeth. But gum disease, or periodontal disease, I suppose is a technical term, causes bone loss as well as gum loss around the tooth. And if we catch it at a later stage, when you have lost significant amounts of bone, I can't put that bone back, and you are at risk of losing teeth. And when you lose teeth, you're either then going to have gaps, or you're going to have dentures, or you're going to need to have bridge work, or you're going to have implants. So if we can get to that gum disease a lot earlier, then your treatment is simpler, is more likely to be regular hygiene appointments, and also patient education, good home cleaning. And the other link with gum disease as well is obviously if you have inflammation in your mouth, you often have inflammation in your body. There's like a known link between gum disease and heart disease.
So there you go. Follow us for more top tips and advice. And if you're looking for a dental practice, please do contact us to book your new patient assessment.